good to be back with you again this morning. So today we're going to be talking about cholesterol. Now, this is a topic I've done before, but since someone wanted to hear more about it, I'm going to get into that today, and we'll talk a little bit about it. And I'm going to be sharing my screen. Bear with me. Okay, so let's get into it. So a lot of us, we like to eat certain things that may be affecting this part of our body or this part of our lab work whenever we go to the doctor. So we're going to go through a little bit, okay? So what is cholesterol? Cholesterol is a waxy fat-like substance that's found in all the cells in your body. Your body needs some cholesterol to make hormones, vitamin D, and substances that help you digest foods. Your body makes all the cholesterol that it needs. Cholesterol is also found in foods from animal sources, such as egg yolks, meat, and cheese. We absorb cholesterol from meat, and as you can see here, your liver also helps with that as well, okay? So how common is high cholesterol? Because this is why we wanted to talk about, right? Because someone mentioned that they had high cholesterol. Over here in the US, it's pretty high. We have about 54.5% to 47 million who could benefit from some cholesterol medication here because of the way that a lot of people eat. Adults aged 20 or older have total cholesterol levels that are higher than 200. And I'm going to go through those numbers slightly with you. So there are two different types of cholesterol, right? You may hear them say HDL or LDL. So people want to know, well, how do you know which one is the good cholesterol versus the bad cholesterol? So when you say HDL, think of happy. So when you're happy, that's a good thing. That's how you know that's the good cholesterol, all right? And your LDL is what's considered the bad cholesterol. So what are your risk factors for cholesterol? Poor diet, obesity, lack of exercise, smoking, alcohol, and age. Even young children can have unhealthy cholesterol, but it's much more common in people over age 40. Are there symptoms of high cholesterol? No. You typically don't have any symptoms when you have high cholesterol. But however, high cholesterol can lead to other things like heart disease, and this month is Heart Month. So medical conditions that can cause unhealthy cholesterol levels, right? If you have chronic disease, diabetes, HIV or AIDS, hypothyroidism, as well as lupus. Cholesterol levels can also be worsened by some types of medications you may be taking, or the health problems such as acne, if someone is taking cancer medication, some high blood pressure medications, again, HIV and AIDS medication, irregular heart rhythms, as well as patients that are on organ transplant medications. So how is this diagnosed? The doctor's going to do a blood test. Most time they do a blood test, right? And that test requires you to fast. So what does that mean? We all know how to fast, right? So for 10 to 12 hours before taking the test, you're not going to be allowed to have anything. Often people fast after dinner the day before because they know they're going to do the blood test the next morning. So you want to make sure that you're actually doing that. And if by any chance, you got hungry and had to eat something, you want to make sure that the phlebotomist, so your doctor is aware as to why something may be off and that you did actually eat something, okay? So what total cholesterol numbers means? Because you might go to the doctor and you're seeing all these different numbers, right? So the numbers are different in different countries. So for example, here in the US, total cholesterol wanted to be below 200. I'm sorry, in Canada, below 5.2. So that's the desirable numbers, right? Borderline, you're at 200 to 239 here. In Canada, it's like 5.2 to 6.2. And that's just to list a few of those numbers because I don't want to bore you with that, okay? What does the LDL numbers mean? Well, below 70 here. And in some other countries, I should stipulate that. In Canada and most of Europe, they want you to be below 1.8 mmol per liters. So this is best for people who have coronary artery disease, including a history of heart attacks, angina, stents, as well as coronary bypass. Below 100 is optimal for people at risk for coronary artery disease or who have diabetes. Near optimal people with uncomplicated coronary artery disease as well. And these are just some of the other numbers, right? So what HDL cholesterol numbers means? Below 40 here and below 1.0 in Canada and most of Europe is considered poor. Better is when you're between 40 and 59, and best is at 60 ml and above. Okay? I don't want to complicate and confuse you with some of these numbers. So what are the complications? High cholesterol can cause a dangerous accumulation of cholesterol and other deposits in the walls of your arteries. These deposits can reduce blood flow through your arteries, which can cause complications such as chest pain. You may have angina attack, right? And what it is that if the arteries that supply your heart with blood, it gets blocked. And so you start having these erratic or sporadic chest pains, which they call angina. So you want to make sure that your doctor is aware of that. It can also cause a heart attack. So that's why you have to be mindful of these levels and these numbers, all right? It can also cause a stroke. Some may be reversible and some may not be reversible. So what are the best ways to improve your cholesterol level? Now, some people, not everybody want to take medications that is prescribed by the doctor, and I'm not telling you not to take it. And no one in CA, none of the officers are telling you not to take it. But we're going to sort of go to some things. I know some people like to talk about vitamins. So while certain vitamins may play a role in managing cholesterol level, it's important to note that they should not be used as a primary treatment for high cholesterol. You want to consult your healthcare professional for proper diagnosis as well as treatment options. So vitamins that are good for high cholesterol. So lifestyle modifications, as you know, is always best, right? It's always great. But some of these vitamins include your vitamin C, your D's, niacin. There's one that I particularly love. It's called Cholesterol Health. And you can always look that up on Amazon or any one of those places. Probiotics, there's berberine, there's red yeast rice, which is also potentially effective. Oats, barley, or other whole grains, beans, your eggplants, okra. Those of us that are from Jamaica, we know about okra. I think most Americans do as well. Nuts, vegetable oils, apples, grapes, strawberry, and your citrus fruits. So you're going to eat heart healthy foods. So you're going to eat things that would reduce saturated fats. You want to eliminate trans fats. Trans fats, sometimes listed on food labels, are partially hydrogenated vegetable oil. And they're often used in margarines and store-bought cookies, crackers, and cakes, okay? You want to eat foods rich in omega-3 and fatty acids, because omega-3 and fatty acids don't affect LDL cholesterol, but they have other heart-healthy benefits, including reducing your blood pressure. Foods with omega-3 fatty acids include like salmon, mackerel, herring, walnuts, flax seeds. You want to also increase your soluble fiber, and you want to add whey protein. Make sure you're aware of which whey protein you're having, because some of them are not 100% whey protein, so you want to look at them, at the labels. Make sure you're reading labels, okay? You want to exercise on most days of the week to increase your physical health. Exercise can improve your cholesterol. Moderate physical activity can help raise your HDL cholesterol, which is your good cholesterol. With your doctor's okay, work up to at least 30 minutes of exercise 5 times a week if possible. If you can't do the 5 times, do the best you can. Do some brisk walking, riding a bike to work if you can, playing your favorite sport, but still want to stay active as much as possible, at least 3 times per week, okay? If you're smoking, quit smoking. You want to lose weight. Carrying even a few extra pounds contributes to high cholesterol. Small changes add up. If you drink sugary beverages, switch to tap water. I know someone told me the other day that they don't like to drink water. You know, be creative. You can add cinnamon stick. You can add fruits to your water. You can do infused waters, like do different things that you can, okay? Snack on popcorn or pretzels, but keep track of the calories, because I know some people like to have these snacks. They have to have snacks. Look at the ones that say maybe 100 calories or less, okay? And try to avoid as much sweets as possible, if possible. If you do drink alcohol, which we don't encourage here, you want to do it in moderation, okay? Treat other treatments that the doctors may say to you. They may give you some statins, right? Some of you have heard those words like Zocor, Crestor, Provocol, Lescol, Lipitor. Those are your statins, okay? Cholesterol absorption inhibitors, okay? That's one called Zetia, They have also the bempedoic acid and bile acid binding resins. Other medications are fibrates. It's called Lopid or Tricor. You know, some people may have heard these names. If you haven't, welcome to those names today, okay? Omega fatty acid supplements that I already spoke about, and that we spoke about the niacin. Now, niacin limits your liver's ability to produce LDL and the VLDL cholesterol, but niacin doesn't provide additional benefits over statins, okay? So just be mindful of that. Now, children and cholesterol testing. For most children, the National Heart, Lung, and Blood Institute recommends one cholesterol screening test between the ages of 9 and 11, and then be repeated every 5 years after that. If your child has a family history of early onset heart disease or a personal history of obesity or diabetes, your doctor might recommend earlier or more frequent cholesterol testing. And I wanted to point this out because there's a lot of children that we're realizing, and I'm sure many of you have seen, that are troubling with obesity. And so want to be mindful of the things that they're eating, the things they're eating out. Try to prepare things from home for them to take to school as even snacks as well. Okay, so when do you see a doctor? So according to the National Heart, Lung, and Blood Institute, a person's first cholesterol screening should occur again before ages 9 and 11 and then repeated. The NHLBL recommends that cholesterol screenings occur every 1 to 2 years when men are ages 45 to 65. So you want to make sure that you're seeing the doctor. If you start having, as I discussed earlier, any chest pain, you're having palpitations, you're also having difficulty sleeping, like any kind of symptoms that you have that is out of the ordinary, that is not your normal, you want to speak to your doctor about that. And that does not only apply to cholesterol, it applies to anything that may be going on in your body. You know your body best. And so when you feel something that is unusual and different, you want to make sure that you're documenting that. You want to talk about, like, were you doing something when this happened? Because it could be an activity that you were doing. It could have been something that you ate. It could be something that you drank. It could have been a place that you were in an environment. You want to make sure that you're mindful of those things. And not only for cholesterol, but with anything that you want to communicate to a doctor. You want to make sure that you're a good historian when you're communicating information so you can be properly diagnosed and properly treated, okay? So in summary, I just want to make sure the information that I provide to you is not intended to replace any advice given to you by your healthcare provider. Please keep up with all your follow-up appointments with your doctors, your yearly physical. In addition, any information that you choose to utilize is your individual sole responsibility, and hence release CA officers, ministers, and medical staff from any liabilities with the information that I've provided to you today. I want to give special acknowledgement to Medline Plus, Verywell Health, Cleveland Clinic, and the Mayo Clinic, as well as Heart.org for the information that I've provided you today. Should you have any questions or any concerns regarding this topic or any other health topic, please feel free to join me in the Zoom room immediately after service, and I'll be happy to answer those questions for you. Thank you so much for your time and attention. I hope this was helpful. And should you want to look further, Brother Rob is going to have this posted on the YouTube, so you can feel free to check out NurseLisa Douglas on YouTube. God bless you and enjoy the rest of your Sunday.